face it, for many of us, aging often means dealing with pounds that are often accumulated much more easily than they are discarded. And weight loss can sometimes not only be frustrating and difficult, but can be dangerous without doctor supervision. Well, we have with us this morning Dr. Timothy deRoos of Infinite Health Systems out of Cleveland to show us a responsible approach and in many ways a new and holistic approach. Thanks for joining us.
Thanks for having me, Jess.
All right, so Dr. deRoos, tell me about your system and what makes it unique and so successful.
You know, what sets us apart from traditional weight loss is we look at the patient's whole health picture. So many times that's not even brought into the equation. And many times it is under doctor supervision, which is paramount. But the gimmicks and trials of the past are more about changing chemistry from the outside in. And what we do is we change our body chemistry from the inside out.
Right.
And if you take a look at how our body's biochemistry transitions from being a sugar burner to a fat burner, it's all chemical related. It's all biochemical related. And what we see in America today is we're overfed, but we're undernourished. So our approach is different this way. We incorporate whole food nutrition and extracts that are very concentrated to replenish what's been depleted in our bodies. Because if you go around with a body that's depleted, biochemically, you're not going to be able to make all the necessary elements it needs to function optimally.
Your energy even, especially.
Especially your energy.
And you make this as a very educational system, and you're right there to help us along the way. Kind of talk us through the process.
Okay, so when a patient comes, the first visit is completely free, and this is why. Weight loss is individual. So our plans are all customized because of that. When someone comes in, you know, many people, they'll come in and they want to lose anywhere from 15 to 20 pounds to 150 pounds.
Right.
The range is varied. When someone comes in, their history is completely different. Some may be on pharmaceuticals, which are all acid-based, and some may be on none. So we have to customize based on if someone is on hormone replacement therapy, if they're on a boatload of pharmaceuticals, that affects how well their body transitions from being a sugar burner to a fat burner again, or revisits that.
And you brought with you an example of what you use. Now this is an example of fat, but how much is this?
This is 5 pounds of typical white fat.
5 pounds.
5 pounds. And if you pick it up and place it on your knees, you can actually feel the gravity of it.
Right.
So many times people will want to lose 5 of these, right? 25 pounds. Some people want to lose 25 of these, 125 pounds. And that really takes an enormous burden off of folks when they remove that from their body habits.
It's a dramatic difference.
It is. And it's marbled through you. It's not just hanging in one spot. It's marbled through your internal organs, through your muscle, all throughout the body.
And more that you're finding out that your patient's why is one of the driving factors as to, number one, why they're coming to see you, but what makes this successful.
Everything from ringing my phone to following through successfully on the plan, their why is paramount. And this is because emotionally, our emotions are what motivate us to act. And if you invoke your emotion, you're more likely to be successful. And you're more likely to change the way you think about food, the way you think about the course of your day, how you conduct yourself. Are you more active? Are you more involved in thinking about food by design rather than just as a emotional comfort? Because a lot of people do.
I stress eat, that's for certain. I really do. And it's not a good habit. It's really not. And not only is your program a very holistic and a full approach, it's a very educational approach, it's going to be a change that lasts. It's not something where you're going to lose the weight and we're going to have to come back and see you in 6 or 8 months.
No, it's designed to be a sustainable plan, and that's what we're most proud of. The backbone is sustainability, which means this. You're actually going to relearn what you think about food, purchasing food, whether you're going to the grocery store or going to a restaurant. Even if you go on vacation, you can still do this plan by its design because it's portable, it's user-friendly in every way.
Creating that new lifestyle.
Yeah.
All right, Dr. deRoos, what's the best way for us to get in touch with you and schedule our first free appointment?
Our number is 423-813-7575. You can also go to losethefatsplural.com, losethefatsplural.com.
All right, well, we are so excited. Go ahead and get started. Why would you not take that first step in becoming the better you, right?
That's right.
All right, Dr. deRoos, thanks for joining us. We'll talk to you again real soon.
Thanks, Jess.
And we'll be right back on Let's Chat.